Send us live?
Yes.
Oh, right, okay.
I'll let you start. So we're going to be with Trevor and Steve, not Senator and Deputy tonight.
Oh, no, I think we should be very formal. We're politicians, after all. No, I had given this some thought, and I think, frankly, the more you know about the two of us, the better. I'll introduce myself, and then Steve will introduce himself, along with titles. I'm Trevor Poynton. I'm the elected deputy for St John, and I'm also the assistant minister to the health minister and to the children's minister. That being because both have responsibilities for mental health, and my responsibility is for mental health. But I'll be referred to as Trevor from now on, thanks. And this is Steve Pallett.
Good evening, Trevor. Nice to meet everybody tonight. Hopefully we're going to have plenty of interaction. But I'm formerly the Constable of St Brelars as well, which I was very proud to do for a number of years. Served in government up to November last year, but since then joined the Corporate Services Scrutiny Panel and the Economic Affairs Panel, and I've got to say, really enjoying myself back in scrutiny. So I'm going to hand back to you, and we've got a few questions just to start with.
I know that it's very busy in scrutiny because I spent up until the late last year, December last year, part of the Health Scrutiny Panel and the Education and Home Affairs Scrutiny Panel. I actually was Steve's replacement. Steve was, before me, the Assistant Minister to Health. But enough about us now. We have been asked a number of questions by people who are interested in mental health in this Mental Health Week. And you doubtless will have seen stuff in the local press about what we're doing, and we'd like to discuss that with you and answer your queries. A question we've had, which I will field to Steve. These are questions that have come into us in advance of this session. Steve, what does mental health mean to you?
Well, there's two parts to that. It's what it means to me personally and what it means to me, I suppose, as a state member. Personally, it means having a quality, happy life where you can contribute the most that you can to the job and your family. And I've learned over the last few years how important having a stable life and good mental health is. Because when things don't go well or don't go right, it can affect not just yourself, but it can affect people around you. And I found that to my cost once or twice, and you have to work your way through that, and you need friends and colleagues and people that understand that. But I think professionally, as a states member, I didn't know a lot about the mental health service until I was responsible for it politically. But it was I found it fascinating. It was there were some really excellent people working in the service, as Trevor knows, that are only too keen to help and support islanders through difficult times, and the services, I think, improved over the last few years. It has had difficult times, as Trevor and I both know, but I think what I think we both want to see is islanders have the access to the support that they need, and I'm hoping that people have seen some difference and will carry on seeing improvement in future months and years.
Yes, it's interesting that most people structure their lives in order to protect themselves from the stresses and strains of life. There are obvious pinch points in life, and I can share an experience that I had when I was employed. I was employed by a charity. This is some many years ago now. And the trustees felt that the way I was approaching the whole thing was not to their liking, and so I lost the job. I found another job immediately, but that was an exceedingly anxious time because I had to think about where am I going to get the money to support my family. and that's a desperate situation to be in. And when you hit those pinch points, oft times mental health can become disturbed. Clearly, before the things that went before that event and your ability to cope with major traumatic events makes a big difference. But for lots of people, fairly early in their lives, maybe they haven't had those sort of experiences and they can't cope with it, and that's when people become mentally unwell, and it's a problem for us.
I mean, I know, Trevor, that you've been involved professionally within mental health services. I mean, what drove your initial interest in mental health?
I've always been concerned that people need to be resilient in relation to the challenges that beset them. But from an early age, 16 as it happened, I was very interested in getting into caring. And when I was during the course of a nurse training, I began training to be a mental health nurse. And went on in the sphere of mental health to manage mental health services, both in Leicester, my hometown, and also in Cambridge, where I was responsible for delivering community services, inpatient services, outpatient services, and so on. It was an experience that really cemented my relationship with the trauma of mental ill health, the trauma from the very least anxiety provoking situation to the trauma of having a severe mental illness, which requires medical treatment. So that's where my interest came from, and I've retained that interest along the way. And I find myself having come full circle, really, having responsibility for the mental health services provided to children and to adolescents and to adults as well. I don't know whether that gives you...
Well, it gives me an insight that I didn't know. I mean, I didn't know you were involved, but I didn't know, obviously, the background and the history. So I think everybody would have found that particularly interesting. I mean, from my own point of view, I mean, most of my working life and sporting life has been involved in sports that a lot of people would consider, certainly at the time, were quite macho and quite men-oriented. Mm-hmm. And I think what I've learned from that experience up to the time I joined the States was there was a lot of practices, a lot of things that went on, certainly within the building trade as I grew up, that I look back now were harmful, weren't particularly supportive of colleagues. And I think I'm now beginning to see with some of the friends I've got that I used to work with and how they've suffered over that period of time and having issues themselves with mental health. But the good thing is owning up to it and admitting that and looking for support. Sometimes with friends, but sometimes in a more professional way. So in a way that's sort of driven my interest a little bit more. I mean,
Well, I mentioned the building industry, and it's not just the building industry. Men especially have had a serious problem being open with one another or with their families about the emotional experiences they're having at the time. And that is, or has been, to do with the culture of being seen to be able to manage, being seen to be able to cope. Because it lets down the side, or it lets your image down if you're seen to be vulnerable in any way. It's very difficult for men to, and even now, even today, it's difficult for men to have relationships that are softer, unlike women who tend to have softer relationships.
But they're more open with each other.
Yeah.
They're prepared to talk about things that maybe men wouldn't necessarily talk about, and but as I found over the years, there's a lot to be learned from women, and what I found that with working with a lot of our colleagues in the States, we bring a different approach, bring a different view, and what we all want to see is I think a States Assembly that's a lot more diverse and a lot more open around talking about things like mental health. But I mean, when you joined as a States member, I mean, did you think it was going to be a stressful? Did you find it stressful? And if so, I mean, how did you deal with that?
I didn't find it particularly stressful joining the States. I had other preoccupations when I came here. I pointedly did not take on any responsibility other than to join scrutiny panels. The reason for that was that I, at the time, had a bladder cancer, which I was being treated for. And I had to have, of course, the chemotherapy. I had to go off to Addenbrooke's in Cambridge. That was interesting, because that's where I worked for a long time. And get some radiotherapy. And fortunately, things are fine now. But that was a period of intense stress in relation to the condition, not in relation to coming into the States. I thought to myself at the time, coming into the States and having to learn the ropes and delivering a maiden speech and having conflict discussions with other members was the least of my worries at that time. So.
I found it difficult to start with. I'll be honest. As much as I enjoyed I did a little bit in the Honorary Police before, which I really enjoyed. I certainly wanted to learn about the parish, which I did. But I think coming into the States, I did originally, starting off, question whether I was capable, whether I was good enough to be able to be an effective States member. And it took a while for me to really understand what my role was, but unfortunately I met people that gave me good advice. Try not to read everything, try to specialise in things. If you've got an interest in something, make sure that you try to concentrate on that. And I think that got me through that period. And then you open up, and you're probably a little bit more open to taking on more challenges. But I've after a couple of moments where I did struggle a little bit, I certainly went back to going back to the sort of lifestyle where I did have time for my family, I did have time for myself, and I tried to keep my sport going, and I do a lot of swimming, and for me that's the outlet. That for me sets the day off, it's before work starts, so I can get it out of the way. And then going into work in a good frame of mind. So I think it's a balance, and if you can keep the balance right, then it keeps the stress levels relatively low.
In a sense, this year we've had off, and some of us are only just getting back to being out and about, and actually meeting people, because we've been working from home, and we've been meeting at home, and the amount of work that's been going for us. It's been so intense. There's been little time to do anything other than States work. When the pandemic first started, there was a whole raft of legislation we had to approve. It was desperately fast moving, and I've had to engineer a regime in which if I've got a morning, I can stay in and have a sleep in. I make sure that I turn off the computer at 5 o'clock at night, and I go and cook the supper, and that is an absolute must for me. It's part of my relaxation process. Is being creative about food. So I often find that emails are coming, and when I open the emails again the following day, I find that emails came in at 10 o'clock at night, and I think, why are people working at that time of night? So I try not to do that, and that's my checks and balances, if you like.
But a lot of us have had to work differently. Obviously, work virtually, which I think a lot of us found quite difficult at times. Technology, we had to learn more technology probably in a short period of time than most of us did before that. But I miss the day-to-day contact. It's something that I enjoyed. I think the opportunity to talk to people face to face, and I think that's something I'm looking forward to getting back again. There's nothing better than if you've got an issue with somebody or something you want to discuss it face to face. So I'm looking forward to getting back to that. But when we talked a little bit about how we've coped, but we've got pictures of a natural environment around us. I mean, is that something that you've made the most of over the last year?
My wife would say I haven't. I would think I have attended the doghouse a few times, and I've been around the garden and done some walking. I'm not great at exercise, unlike you, Steve. Well, you can see there's a difference between our physical presentation. I don't get
horses for courses.
Yeah, I don't get that much exercise. It's not my forte. And yet I used to be an army officer. I used to run a cross-country team over mountains, and thoroughly enjoyed it. But life's different when you get a bit older, isn't it?
We all get older, and everything aches more than it used to.
So no, exercise isn't my first concern. And as my wife said, over this past year, Trevor, you've lived in your head, and that's that's how I tend to cope with things. The other thing is that for me, an advantage to being a remote worker is that my fuel consumption is diminished to the nth degree. I used to do 500 miles a month, full time every month. I'm doing about 200 miles a month now, just going to the supermarket. And that's probably where I get my exercise, is going from shelf to shelf.
It's funny. I mean, I'm out. I spend a lot. Well, if I'm exercising, I'm not a big fan of doing this, so I do a lot outside whether it's out walking or doing a bit of jogging or like I say, I do a lot of swimming. But I think what I've found, and I think it'll also come on to the next question, is that there are so many islanders, so many local people now that it's pretty obvious made the most of the environment through what was a very difficult period of time. I mean, I've never seen so many people out walking, running, so many people cycling now, which again is good for the environment as well. But the number of people swimming and got into cold water swimming and open sea swimming has been just incredible, which I think will have a long-term benefit for them, but I think a long-term benefit for the island as well.
Well, and of course, in terms of mental well-being, exercise is one of those things that is a release. It raises your endorphin levels. It keeps you physically happy. For those who don't know what endorphins are, they're the natural morphine that your body produces when you have an exciting experience. Yeah. So it's very much a part of good mental health, good well-being is keeping fit to a level that you can tolerate and all want to tolerate, because it's, not everybody has to be an athlete.
No, and that's important to remember. I think our new strategy around physical activity is around it's active lifestyles. It's keeping active. It doesn't necessarily mean you have to play a sport. So for some people, it'll be gardening, and that'll be enough for them to keep active. We've got to remember, not everybody's going to want to go out for a run or go for a swim in the sea.
That's right.
Their own level.
And of course, remember that eating well and eating the right food is even the fittest can be eating the wrong stuff, frankly.
Yeah, I'm a little bit like that. I'm always told off by my wife, who's now vegan, that I eat all the wrong things. But I'm a chocoholic. But I don't drink, smoke, and I very, very rarely gamble. So if I can't have a bit of chocolate, then Well, it's not going to be worth learning.
Oh dear. Yes, well, our son's in Beijing, and he's following Buddhist teachings, and he's vegan. And when he returns, we are vegan also. So,
Well, I'm beginning to learn the vegan ways of life, and it's not. It takes a bit of time, but I think if you've got a good cook, and my wife, I've got to say, is an excellent cook, so I can sort of live with most of the things she cooks. But I'm going to ask you a question, because, like you say, you've got responsibility for adult mental health, and this is from somebody. I'm concerned about a neighbour, about what help is available for people having mental health struggles. What would you suggest?
well, we've just been talking about fitness and endorphins and ensuring you produce your own medication, as it were. But I think people will need to look at their lifestyle. What are the support structures around? Who do you rely on? I mean, are you isolated? Do you have people you can talk to? Do you have a group of people who are friends? What you don't want to do is to get to a situation in which your anxiety or stress is at the level to become ill. But if people do become ill, the mental health services have, over the last year, we've developed specific crisis intervention services to give people assistance in the initial, in a crisis phase of any mental illness. And of course, mental illness is exactly the same as physical illness. And if you need support, just as if you need support for a broken leg or what have you, take yourself to A&E. That's one of the entrances into the system, or to your GP. But frankly, you don't need to go to your GP. You can access mental health services direct. And that's because we understand that mental health services need to be readily available to everybody. As a matter of interest, putting mental health onto a par with physical health, that we call it, to give it parity. The new hospital is going to have its mental health facilities co-located with the physical health facilities. We want mental health to be seen as an equivalent of physical ill health. We don't want to be treating it any differently. We want to take the stigma out of it, and that's what we're trying to do.
Well, of course, I don't think either of us want to see people get to the point where they need professional help. But I think one of the big successes, I suppose, over the last year, you visited it, I visited it, and we know how well it works, is the listening lounge. And I think we know the level of support that service is given to islanders for all sorts of reasons. It doesn't have to be a pure, a serious mental health illness. It could be anxiety. It could be a family issue, and they have provided that level of backup to people. And for many, that's what they need just to get through that specific period. But the good thing with them as well is they're good at identifying a serious issue if there is one, and leading on to potential referral into talking therapies or perhaps above that.
Well, as a matter of interest, before the listening lounge came along, and it is specifically for adults with anxiety and emotional problems. Before the listening lounge came along, the Jersey Talking Therapies facility was absolutely snowed under. The listening lounge have taken the pressure off Jersey Talking Therapies, where the clinicians are able to offer a specialist mental health counselling service. When I say clinicians, I mean psychologists, psychiatrists, nurses, and so on. And the pressure has come off them because of the listening lounge. And the listening lounge have been so successful we are now discussing the possibility of opening a second listening lounge. Unfortunately, that won't be this year because the funds have been diverted into COVID, and in fact, some of our services in children and adolescent service have been enhanced because of COVID funds. And the service for crisis intervention has been funded that way. But as for funding second listening lounge, we will be putting a bid in to repeat the success for in 2022, when we will have something into the government plan to get the funds to develop a second service. Much needed. The demand is very high, and yeah, we recognise that.
But another area, again, some of it was, I think, preempted a little bit by some of the issues that came out of COVID at an early stage, but it's certainly been around prior to that. Certainly, certainly the police had potential issues around was making sure that we could provide street triage and making sure that we could deal with issues on out and about on a Friday or Saturday night when sometimes under the influence of alcohol, drugs, or whatever, people are getting themselves in trouble and were often ended up in places of safety where they didn't need to be. I mean, do you think that's been a success as a service? I mean, I believe it has, but I think it's been supportive to the police, and I think that relationship between adult mental health services and the police has improved, I think, over that period of time.
Which is precisely what the crisis intervention team are there for. To work with the police and other emergency services when they come across problems with people of a mental health nature. And yes, it is taking a lot of stress out of the relationship between the police, especially the police, who, as you would imagine, are really concerned about maintaining their response often to a mental health crisis might not be appropriate.
I'm sure it hasn't been at times. I want to change the subject because we've actually had Susan on Facebook to ask the question. I think it's obviously this is going into children's side.
Yeah.
How government working closely with schools, and she's backed that by saying getting children diagnosed is overlooked and this can be life changing.
Yes, albeit I have a responsibility for CAMS, that's under the auspices of the Children's Education Service. The Education Service, or the schools, have a psychological service, and they have school counsellors. And I'm working toward trying to have a much more integrated relationship between CAMS, who are providing specialist facilities for eating disorders and children with high-end mental illness. That they should be much more closely aligned with the school counselling service, and be, if you like, the directional guide for that counselling service.
I mean, I don't want to be critical of schools because they've got a difficult job to do, and they have to deal with some quite difficult issues at times. But one of the issues that did come out of conversations that myself and Deputy Luce had with a group of young people was around consistency and making sure there's consistency within schools, especially secondary schools, around the level of the counselling and the level of support that's available. Is that something that you've had any knowledge of? I mean, I can only go on the feedback we've had from people. I mean, some of the support's been excellent, and the right support, if it needed to go in, support from CAMS has been available. But you get others that say that's not been the case, and they felt let down. Do you think there's a need to have consistency?
Well, the school counselling service, of course, is term time only, but young people do have an opportunity to avail themselves of the YES service.
That's excellent.
The youth education inquiry service, They can also access a service at Mine Jersey, who are specifically working with young people. So and the Listening Lounge are now considering their relationship with younger people because there is such a demand. So it's not exactly right in terms of the support available, but it is developing and it is going to be, I think, much more meaningful to young people.
It's not for me to ask you a question, but I'm going to ask you a quick one. One of the concerns I had, certainly when I was looking after mental health, was that transition period between 18 and 25 and making sure that there's good correlation between the two services. I think it was improving. I mean, do you see that needing to be improved even further moving forward?
Well, it's something that is a hot topic because it used to be that when you reached 18, that was it, canvas fixture. We fully recognise that you've got to have seamless service. So we're working together as across the board with what we euphemistically term a mental health development arrangement, in that the children's services and the adult mental health services are working very closely together to make sure that there's a handover, and in some instances, especially in social care, children's social care will keep responsibility for people who have been looked after by the government until age 25. So that's the way forward we see for the seamless transfer of people into mental health services.
But that seems to be sort of the sort of wraparound care built around each individual, and each individual case is unique in its own way. And we all know we all grow up at different times, and sometimes I think you've got to take into account.
Well, I think there's enough science around now to say that the adolescent brain, and I don't want to distance this, but people who are growing up through their adolescence do mature at different times, and it's not until young people reach the age of around 25 that they have developed fully their cognitive abilities. So, we've got to recognise that as a service responsible for people's mental health. You can't ignore that science.
One of the areas that I had concerns about, and certainly I was looking to try to get a little bit more collaborative working was actually the governance around both adult mental health and children's mental health. We've got a mental health improvement board that was just focused purely on adult mental health, and I know when I was leaving, there was talk of potentially that board widening out to cover children's mental health. I've not been there for the last 7 months. I mean, is that still current thinking, or do you see them as two separate services with governance in a separate way?
Although CAMS are funded through the education service, their governance is taken care of in relation to by a relationship with health. It would be silly to say that education, or SIPES as we call it, could have an understanding of the governance needs of children's mental health service. So there is a strong relationship between children's and adult mental health services. As for the development board that Steve's just mentioned, that has not been operating for the last few months, simply because of the COVID situation. And in fact, the person who chaired that was diverted into engineering the vaccination services and so on. So we're readdressing that now, and we're bringing both services together to jointly develop the offering to both adolescents and children and adult mental health. So we're very conscious of that, and we want to develop that further.
I think we've had a question from Aaron on Facebook, which sort of I think we've covered, but there's probably one little element of it I don't think we have covered, because he was saying that, or suggesting that should the age limit for CAMS be increased from 18 to 25. I think what you're saying, I think what I've said as well, is that, you know, they're defined services, but they do need to work more closely together. Would that be a fair reflection?
Yeah, that is the case, and although we say that the human brain hasn't developed sufficiently until somebody reaches 25, in all other intents or purposes, you are presented with somebody who's very much an adult. When you have somebody who's 21, 22, 18, 19, so there's a fit in relation to services. Adolescents and children do need to be separated for safeguarding reasons from people who are, to all intents and purposes, presenting as adults. When I refer to the brain capacity of a 5-year-old, it is just that. Those 18s to 25s are driven by all of those things that adults are driven by. So we don't want to mix the two. For example, inpatient services are for people over 18 are dealt with differently.
You know the difficulties around that, and co-locating them, for example, and the issues around that.
Yeah.
Well, this is going to be one for you, and I would struggle with this because I have little to do with certainly around early help. But simple question: what's the difference between early help and CAMS?
Well, early help is the process of providing people with opportunities to access low-level support systems. If you have missed out in terms of early help and you've reached CAMS, you've become pretty sick. So early help is about the facilities available to people to access before they become sick.
So whether that's in the youth inquiry service, or whether that's at school, or whether that's at a youth club, it's providing that. It's identifying it and dealing with it early on.
That's right, and giving people the skills to try and avoid that the difficulties they're having developing into actual illness.
Well, we've done 3 questions from those that have been watching. I mean, if there's any more coming, then we'll certainly answer them. There's another one. Okay, well, again, I'm going to, as you're in the thick of it, I'm going to ask you this again. I'm quite happy to add on it. How is mental health being considered against the behavioural units of education facilities? And then I suppose a follow-on question for that, connected. Why won't the government support inclusive referral units on site at secondary schools? They're big questions.
Well, they are big questions, and if the person asking that question could give us a little more information about the background that they see and their knowledge of what has been asked for or not asked for, then it might be much easier for us to answer the question. As for integrated behavioural units, I see no reason other than the cost of such units and the provision of qualified staff to staff them, which includes cost, of course. I see no reason why we shouldn't bring the initial support closer to schools.
Well, I suppose if we, I know I signed on. I think I'm sure you did as well. The putting children first, and clearly, we've got to back that up by action. But I think in terms of inclusive referral units on site at every secondary school, I think we'd have to look at how that was going to be staffed, how it was going to be funded, and the numbers involved. Now, it shouldn't be about numbers, and it shouldn't be about money. It should be providing a service for young people. But nevertheless, I don't know the numbers involved. I don't know the number of young people that are currently having issues at school, requiring that sort of intense service. You may know more than me, but I would suggest that I think it'd be difficult to cite them in every single secondary school.
As Steve says, the problem is funding those efforts. Not that we wouldn't want to see those facilities. We definitely would want to see those facilities, but everything's finite. But if you were able to let us know your experience of the arrangement and where the idea comes from, where the idea is actually being practically delivered, and perhaps what efforts you've made or you're associated with have made to initiate these facilities, then we'd like to hear about it, because the idea has my backing, because if you take the facility closer to the user, the uptake will be much greater.
Well, you heard it here first. I think what we'll do is that we've taken a note of all the questions. So there's some more information we could probably, or certainly Trevor, from a government perspective, could give about this. So I'm sure we'll be able to follow that up with more information afterwards. I'm beginning to feel like an interviewer here, but there we go.
Yeah, this was going to be a double act.
Okay, where are we? How do counsellors at school fit into the early help model, and what inspection is done of them? I think we've talked a little bit about counsellors,
yes,
how important they are. I think all schools have them. I talked a little bit about consistency and making sure the approach is consistent, so that people get the support that they need. But I don't know about inspection. I don't know how that's done, or whether that's done within schools. But I don't know whether you can help on that one.
I don't know the arrangement for inspection, but certainly people who are counsellors have to register with the Care Commission. So there are some checks and balances in there, and of course the School Psychological Service would not be appointing people who are not suitable for the role. And these people do have training in the counselling field, and they work with parameters that have been set up to attempt to meet children's needs with the resources available.
Well, the other part of that question was around, and again, I think we've touched on it as well, is how counsellors fit into the early help model, and clearly it's probably the first line of defence. The opportunity for those counsellors to deal with things at a very early stage. So I think we probably covered that one. This is an interesting one, because I think it's, I think we're both supporters of the youth service and the work that they do. We've got an interesting proposition coming up about the youth service, and whether it should be statutory or not, but we won't get into that tonight. But why is mental health being provided more so by youth service rather than the very expensive and out of date children's services and CAMS? I've got my view. I'll kick off and I'll.
The youth service has been integrated into the early help arrangements, and we recognise that young people do need to have people other than their parents, for example, people close to them to talk to. and the Youth Inquiry Service gives them that facility. It's somewhere to go. It's not a facility in which they can obtain treatment for severe mental disorder. It's a place that that people can go to deal with some of the anxieties and stresses that might possibly lead to mental ill health. And that's what the process is all about, is trying to, as we said earlier, the process is about trying to avoid becoming mentally ill, which is quite different to being anxious, being stressed. But if you don't have that support framework that, and other services, Mind, can assist with, you may be so dogged by your anxieties and by your stresses that you do become mentally ill, and that's really not what we're looking for. Once you get to mental illness, that CAMS is the service, because it employs doctors, nurses, psychologists, and some therapists to assist people who have quite severe mental illness.
Well, there's no doubt CAMS is an expensive service to run. It's housed by specialists and clearly, well, run by specialists. So clearly, there is going to be quite a lot of cost to that. But I think from my point of view, the youth service, I've been involved with some neurology project now for probably 10 years or more, and I think the thing with the youth service is that they do take a lot of pressure off young people. They do give young people an outlet. But a lot of the workers within, even the youth service workers, are not trained as professional mental health counsellors. Although they do provide support, they do provide, I think, the early help support that we've been talking about. They're very much jack of all trades, I think, youth service staff and helpers. And I think we've all got to be careful we don't pile too much pressure on the people that help and support at youth clubs, because they do offer such a great opportunity for young people to do a lot of things that they might not do at school, opportunities to some of the activities they can do outside of school, for example. What I would say, though, with the youth service, and it's important that it's inclusive and that every child gets an opportunity to do those activities. I think we're a lot better at that now. I think, we've heard stories of children, never been to the beach. I mean, that horrifies me when I hear things like that. And we've got to make sure that opportunities are there for every young person. But I hope that question's been answered. That CAMS is a specialist service, and it's there for.
It is, and surprisingly, there's another question arrived here that is specifically about access to CAMS.
Okay.
The question is, what if a person is not aware of the help available and they are very ill? What action should the mental health service take?
Off to you.
So I'm reading my own questions now.
Yeah, that's all right. Well, I knew this was going to come up because CAMS is, I think is a really important service, and a lot of people feel that it deserves the focus from government that I think it's finally getting. So I can understand why there have been so many questions.
Absolutely. Before I answer the question, we have recognised that the service that CAMS has provided in the past has been really quite desperately underfunded. And the numbers of professionals engaged was far lower than an equivalent service in the United Kingdom, Scotland or Wales. So this year, as a result of COVID funding, we've been able to move £955,000 into CAMS for CAMS to recruit 5 additional staff in order to get waiting lists down, because the waiting list has become horrendous over time. And that, from a reputational point of view, and this is probably part of the question, from a reputational point of view, has put CAMS into a bad light. People did not trust and still go on to suspect that they won't be able to gain access to CAMS when they need it. So, what if a person is not aware of the help available and they are very ill? Well, my concern would be that if the person's becoming very ill, the fact is not being recognised by the people immediately around them. And generally speaking, young people are living within a household and are observed by their parents, their brothers, their sisters. And if people are deteriorating and becoming sick, there's no need to have direct access to CAMS immediately. If you're becoming sick, like anybody else who's becoming sick, go down to casualty. Go and seek assistance down there, and you will be seen immediately. You might have to wait an hour or so, but you will be seen by qualified mental health practitioners. And if they feel that you're, use the word diagnosis. If there's a diagnosis that there is a mental health condition, then a crisis intervention team would get involved. And we don't want to admit people to hospital. That is the last thing on our thoughts. But we would like to offer people who come into mental health crisis the support of professionals, either in the community or as a last resort in an inpatient facility.
The adult mental health service, I think a lot of people would say, is pretty well defined. Some people may criticise it, some people may say over the years it's not really provided the service that everybody was hoping for. But it is well defined. I think people know where to go. I think the mental health network, or I think something that I called it very early on, which was a roadmap to mental health services, is quite clearly set out now. And the mental health network, I think is an addition to that. I think it really has added to people's understanding of what's available. I think one of the things that I certainly had a concern around was that didn't seem to be as clear with CAMS, with children's and adult mental health services. Is that something that you'll be looking to do to make sure that there is a clear roadmap or a clear network of how children's mental health services will work?
Yes, clearly we want people to, and this is the reason why we've published this week the new direction for CAMS.
That's why I just pulled out my bag. Believe it or not. And I was going to ask you a question on it.
Yes.
This one.
Yes, that's right.
Yeah.
Yes. That's why we've initiated this new approach, and we've published the literature we have to give people a clear idea of what services are available to them. We don't want to get to a stage where people are mentally ill. We need to be at the stage where the support systems in the community are sufficient to head off mental illness. But if mental illness does arise, the new approach is designed to let people know how they can fit into the service. Now, we are increasing staff numbers in CAMS, and CAMS do specialise in crisis intervention in that their staff team on call will be involved with somebody in crisis. CAMS has not deserted everybody altogether. It's not all by appointment only.
I'm pleased this has come out because I think it's been needed for some time. I think what I got out of, there's a lot of information in it, which backs up, I think the sort of the strategy towards the end of it. clearly within it, I think it shows how important, especially with young people, how important the family unit, how important the family unit is, and making sure that that the care not just provided by services, but the families are given the necessary support and care they need to get young people through it. I'm sure you'd agree with that and take that approach. But how are we going to ensure that families do feel that they've got an integral part to play and understand their role within that? Because sometimes if you've got a child that you may feel it's difficult, but actually you've got an underlying mental health illness, sometimes that's quite, I think as a young parent, that must be quite hard to understand. Have you seen that within your professional life?
Well, in my experience, there aren't any people who are bad. There are people who have challenges in their lives, and some young people grow up with challenges in their family experience, for example, and they are not equipped with the skills to be able to manage the crises in life. Now, there are a group of people that we're currently having some difficulties with in the town area and in St Brillard and so on. These are young people, a very small number of young people, who are causing problems for the courts and so on. Hitherto, we've been approaching these people from a policing point of view. And clearly, as Einstein said, if you keep on doing the same thing,
we know what we're going to get.
you keep getting the same result, but you keep on doing the same thing, then you're never going to improve them. And we are currently, there are currently discussions underway with Children's Service to, for example, make a therapeutic provision for young people who need that provision, for the police and social services to work closely together, for probation and social services to work more closely together, to have a direct strategy to assist these children who are seen by society as needy. Well, lock them up. Get them out of society.
Well, I agree with you. I don't think any child is inherently bad. I think there tends to be a reason why a child or a young person's acted in a certain way, and I think but I think some people do think that there is a balance to be struck between law enforcement, or make it be it through the honorary police system and that of providing support for that child through different services. I mean, how do you structure that balance and make sure that we're getting it right?
Well, you're right. I mean, I was a centennial for many years.
Joined the gang.
Yes, and I think the beauty of our system was that we have a tool called the Parish Hall Inquiry, and we were able to confront young people with their behaviour and ask for reparation if there'd been damage done or people had been offended or whatever.
That type of restorative justice, do you think that we've taken that as far as we can? Or do you think we can still develop that further?
Well, I think in probation are trying to, with the centennials, develop that further.
That's something I'd like to see, because I think there's more opportunity there to, educate children. I mean, like I said, I don't think children are bad at heart. I think they need to understand what they've done.
Yes.
They need to understand what the issues are.
But you imagine a situation in which a child has grown up in a household that is fairly disjointed, where there's perhaps domestic abuse, but perhaps relationships that are confrontational,
Or we're down to the inequality issues, which we know are quite prevalent in the island, urban compared to the country, for example, where, quite often, and this is not to blame any parents, a lot of parents are under all sorts of pressure at the moment through housing costs, low income, and haven't always got the time to give to the children.
You're right.
And there lies some of the issues behind where we are.
I've got
the questions
several
are
questions
flying
here.
in.
Yes, they are, and we've only got about
A few minutes.
minutes left. I've got a question here to ask me specifically. Will you seek to reverse Charlie Parker's decision and move CAMS back under health instead of education?
I know the answer to that.
Well, when I first learned...
Where was the scrutiny panel on that?
At the time, I felt it was not appropriate to have CAMS under the auspices of education, to be narrow about it.
You change your view on that now?
Well, what I've done is I've worked now with the team in education with children's social services and education itself and CAMS. They actually do fit together. They fit together, but what I'm endeavouring to do is to have CAMS take a greater lead in relation to those other services. The support...
That's almost saying that health haven't had enough input into that.
Health and CAMS work very closely together at that level we talked about earlier, which is the level of monitoring and developing ideas, developing services. But within the structure of education, CAMS can have a really strong influence on the school counselling service, have a really strong influence on what happens within children's social care and so on. And children's social care and mental health are structured in a way that they too have strong relationships with adult social care.
But there needs to be an understanding of where almost where early help stops and the health element kicks in. So that health have got enough input as to what the service looks like and make sure that the extra support is there when it's needed. And I think that's probably where the question is coming from. Is that mental health is a health issue, but at what point does it go from being a health issue to a health issue?
Well, it's actually fairly seamless in the sense that early help and the opportunity to offer early help runs in tandem with the services that are provided when early help has not been successful. So to work closely together in that sphere and to work with health as well, in theory, we haven't had the system long enough to say that it absolutely works. But I'm encouraged by the approaches of adult social care and children's social care, and the way that Isabel Watson is now responsible for linking adult social care and mental health, for example.
And that's been a key change.
Yes. So we are working with these arrangements uppermost in our mind to make sure that the service we deliver is appropriate for children, for adolescents, for adults, and so on.
I suppose the other point about that is I'm not sure that it was Charlie Parker's decision. I think it was a health professional's decision that change was going to be made. I don't think that was driven necessarily by the chief executive.
Well, I was always suspicious that it was driven by the target operating model, but there you are.
Which he drove.
Yes. Yes.
We got any others?
No, what we got?
I'll have a look at that one. What plans are in place to prevent mental health issues? Well, I think we've got a mental health improvement plan. We've got a new, which I mentioned, which Trevor brought out this week, which is the Children and Young People Emotional Wellbeing and Mental Health Strategy. Both of those, I suppose, are key to preventing mental health issues, but it's, I suppose, in many ways tied up to making sure we're investing in the service. And I think the investment over the last 2 or 3 years has been far better than it's been prior to that. And it is about the service, but again, I'm going to ask you a question because it's also about facilities. Mm-hmm. We've got a commitment to better facilities at Clinic Canal. We've got other facilities that have been improved over the last 18 months, but rather than ask you it in the States, I'll ask you now, where are we with Clinic Canal? Is it on target?
Yes, it is. It's causing some disruption from the other occupants in the building. That's the elderly mentally ill. But it is on target, and the sooner we move out of Orchard House into something more appropriate, the better, because Orchard House is not appropriate, although it has been upgraded to make the accommodation more suitable. What we are involved in is putting together a temporary arrangement before we get the hospital built. It's one of the reasons it's imperative we get the hospital with a spade in the ground and get it built.
I suppose another point that will come out of that question is making sure that we carry on educating people, make sure we carry on getting the message out that support is there, not being scared as islanders to talk to one another about issues, because I think that can prevent a lot of mental health issues arising in the first place. I think some of the celebrity input that we've had over the years, from all sorts of people, I think have highlighted issues, and I think that's been another benefit, that if people that we see on the telly, and people that we know, and people that we sort of have come to love, can be honest about problems that they've had, it'll make everybody else a little bit more open to speaking about it. So all of those things, I suppose, in a way, go to help prevent mental health issues. But there will, it's a bit like people will always fall down skiing. There will always be mental health issues because people will face difficulties in their life.
Yes, that's true, Steve. And I've got another question here, which is about the
one for you again.
Which is about the support in the parishes. No, it's one for you actually.
Oh, is it now?
Now, are the parishes trained in mental health?
Certainly from my time as constable, I can't say that was true. I think that there is more. I think within the Honorary Police, I think now there is a, and you've been in it, closer to the time we are now than when I left in 2011. Probably what time of year? Probably about 2016, 2017?
2018, the year of the elections.
And it was becoming more of an issue because of some of the issues that we were seeing on Saturday night in St Albans, and questioning whether people were not just whether they're drunk or whether they could have been taking drugs, for example, but whether they were actually having mental health issues and how you were going to deal with that. So I think that it's become more prevalent. I think the staff in parish halls would probably now have a better understanding and hopefully better trained. But it's something that the parishes do need to take on board. Clearly, we've got myself as constable. We've got residential home in the parish. So I was acutely aware of some of the issues around mental health and making sure that we provided the necessary support. But we do need to move services, and we've mentioned the listening lounge. We do need to move services out into the wider island and not just have them all concentrated in St Helier. I think with the community hub we've got at St Brellard's now, there's opportunities there, and there's already opportunities around providing some health services around around some barrels into community care. There's no reason that couldn't include mental health services, for example.
Well, it certainly is the case that the Jersey care model envisages disseminating the delivery of care and delivery of services to parishes, and of course mental health will be no different. And the mental health service functions in all parishes, and that's where the crisis intervention team are an island-wide facility. So.
And we've got to remember as well, and you mentioned it previously around support for mental health, we've got to remember that we've got GPs spread around the island.
Yes, this is true. This is true. Okay, question about drug and alcohol. Should drug and alcohol policy be the responsibility of health instead of home affairs?
Wow. Well, we've seen I think we've all seen the effects of people that have suffered through drug and alcohol abuse. It's clearly a health issue. The drug and alcohol service, an incredible service. We know the work that they do. Is the right place for them? Health, absolutely. Do they get the support that they need? Do they get the credit that they deserve? Probably not, because I think they do a lot of their work behind the scenes.
I think, though, Steve, the question is more about should we be treating the possession of drugs, for example, as a health matter rather than a
criminal offence.
Yeah.
I think we could get in a discussion now around various drugs, and cannabis probably would be the one that people would highlight the most about. Is it a drug that we should legalise, or do we keep it as a drug that we prosecute people for using? I think attitudes are changing. Clearly, medicinal cannabis is something that is very much in government's mind, not just from a point of view of potentially producing it, but also whether we legalise it and so that people can use it here. And we've made it. Yourself, there are certain types of medicinal cannabis that are available for people on Ireland. But in terms of, I'm a little bit jury's out on legalisation of cannabis, for example. I'm not sure that that's where we want to be at the current time. I know other countries have done that, and it may be over a period of time that we do soften our approach, but I think it needs to be looked at from a medical point of view, and some of the damage clearly it can cause to those that overly use it.
I think you and I have a subtle difference of opinion here. The experience around Europe is that where you legalise, especially the softer drugs, the harms to society are greatly reduced. And the reason I say that is that if you decriminalise cannabis, you immediately remove the bread and butter from criminals who peddle it.
But you can drive them in another direction.
Certainly. The fact of the matter is that where cannabis especially has been legalised, has been very successful harm reduction. And we need to look at the situation very, very closely. I think it's a bit of a juxtaposition, but we are currently allowing companies to come into this island to grow cannabis, to be sold on the world market. But we
scrutiny panels deliberating on that at the current time.
Right. Okay, but that's the dilemma we have.
It is, I think it's one that's going to cause a lot of discussion. I think with the public once some of the facts come out around how we're developing that industry. I think it's one that we need to be really careful around. I mean, I don't want to undermine what my scrutiny panel is trying to do in regards to it, but I think we need to be clear about what we're setting out to do. and what the potential benefit to the island and the taxpayer is. There's a lot of water to go under the bridge with that. This is going to be our last one, is it?
Well, I'm conscious we've gone over time by about 10 minutes. So,
should we call this our last one? We've got a couple. Well, we'll finish the ones we've got on then.
How does a hospital assess the mental health needs of a person? Well, it's a process of assessment by professionals who are trained in recognising mental illness.
Of which we're not.
That's right, we're not. So the question really is something for your medical practitioner, and if you're involved with the service, for a nurse or psychiatrist. I have another question here: what cultural changes are you making to the way public services are delivered? Mental health and education services can no longer be delivered by a 20th century mentality of archaic disillusionment. What views?
That's deep. I'd have to read that again. Are we going to change the way we deliver our services?
Well, I will say I think we have already changed the way we deliver our services. There's a much greater recognition amongst politicians that we have to provide proper services for the public of this island, and it behoves us to make sure that we assess and address the difficulties that people are experiencing. I don't know whether you've got anything to add to that.
Not, I mean, I think we've got to understand why people are disillusioned by services. I mean, I can understand why not everybody gets taking mental health, for example. Not everybody has a good experience through mental health and the services that they are given. And I know that from some of the people that I've met and at Orchard House, for example, who have clearly, I think I've been open and said at times been let down, and we've got to change our approach, and that's what we're trying to do, not just with the service, but in where we deliver it as well. But in terms of public services all round, I think it's every government's job to review how public service is delivered. We've got to look at. I mean, one of the big issues is the cost of public service as a whole, and whether we are prepared to raise the cost of public services to the degree that we're likely to by the end of this government. That may mean, if we're not prepared to spend that type of money, we may have to redesign services and look at the way we deliver services differently.
The problem, of course, is that there's an expectation amongst our consumer population that we provide the very best of services. We are actually one of the richest countries in the world. We have, but there's an expectation that we have the lowest taxation rates in the world and provide the best of services in the world. And that equation actually isn't, those aspirations are not compatible.
But I think after the difficult time we've had through COVID, which has been very expensive, rightly so, there's things that we've had no choice but to spend money on. And certainly with Brexit beginning to really bite now in terms of what it may do to our economy, I think we're really going to have to look carefully about. And again, it's about educating and getting public to understand this, that if you want first-class services, that you're going to have to pay. The problem with that is that people don't want to pay any more tax, and certainly when you've got business coming out of a difficult period, potential recession, is that you don't want to put them under any more pressure. So, but in terms of delivering services, we've always got to look at how we can deliver service differently and better.
We've always got to be as efficient as we possibly can in the delivering of services and make sure we're meeting the needs of the people we call consumers.
But I'd still like to know why this lady or gentleman is disillusioned, to really get to the heart of the question, I suppose.
I think we've really come to an end there. We
Better do that one.
We have one more.
Okay, I'll read that one. Okay, this isn't the question. As we've been told, we've run out of time, but actually, I really enjoyed that. It's been a fun. I've learned a little bit. I've learned a little bit about Trevor that I didn't know about, which is good. I want to thank you everybody for tuning in and asking questions. Because if you didn't ask questions, we'd have sat here just on our own,
Yes.
chewing the cud, which I don't think, which would have been a nice way to spend an evening, but wouldn't be beneficial, I don't think. So if you've got any other questions, please direct them to the Government Mental Health Network. Maybe Trevor wants to say a little bit about that in a minute. It's at gov.au/mental health network. And I think we both say to everybody that's out there, and we've said it, I think, this evening, you're not alone. There is support out there. And maybe you just finish off maybe a little bit about Mental Health Network if you want to.
Yeah, the Mental Health Network is a collection of a provision in the island that is available to people who are experiencing difficulties. If you get in touch on the gov.au site, you'll be able to put your concerns to the site, and an appropriate person will answer your concerns. We look forward to hearing from you.
Au revoir. That's the only bit of French I know.